This is a urinary catheter kit. That was one of the things I was most nervous about doing. Oh, I'm already recording. Look at that.
Okay, sure.
Look at that. Already recording. Okay. You guys know who inspired me to pursue this nursing path is my daughter Raelynn. And she has already taught me a lot. So I want to make a few videos about nursing skills that I've learned thanks to Raelynn. So the first one I wanted to talk about is one of the things I've learned that was the scariest to me, and that is urinary cathing. This is a urinary catheter kit. So first I want to go with why we started having a catheter, because when she came to us, she did not need us to use urinary catheters for her. But she started holding her urine. I think it had to do with the medication she was on, although she's not on that medication anymore and she still has trouble with it. But she was on a medication and she was not having a lot of wet diapers. And I said something to the neurologist and he's like,
if she goes more than 12 hours without peeing and you can't get her to, you need to take her to the ER so they can help her empty her bladder.
So we started having to do that like
way too often.
It was exhausting. Like you'd get there and people were nervous to cath her even. Like I feel like some of the nurses were nervous about cathing a little tiny girl. And a lot of times we'd get there, we'd be in the waiting room waiting, and then she would pee in the waiting room and we'd be like, oh, never mind. She just peed in her diaper, we're leaving. Or we'd get there and when they would start trying to get the catheter in her urethra, she'd start peeing, and that was nice because then they didn't have to like keep trying to find the right spot. But anyways, as they kept having to do that, they were like, okay, this is a simple thing. You can learn how to do this at home so you don't have to take her to the hospital, which I was glad about because you guys know, I mean, if you've ever been to the ER, that's a big chunk of your day, and they wouldn't make her wait a long time. We live in rural Illinois. We were going to little bitty rural hospitals. I say, hey, her bladder's totally full. She can't empty it. They would try to get her back pretty quick, actually. Our local ERs are not usually that busy. And then obviously this is someone who needs their bladder emptied because they haven't gone into a bar sit. So it's not like we were there for hours and hours, but I mean, it takes a chunk of your day. So I was glad we were going to be able to do it at home. We weren't going to have to get in the car and drive 15 minutes and register and wait in the waiting room. But also, like, that was one of the things I was most nervous about doing. I remember my husband and I both went so we could both watch the urologist teach us. They showed us how, I think they had me catheter or my husband catheter after they showed us how. Like they didn't have her get cath 4 times for us to learn. They just, do you all see what's going on? Doing it was not as bad as dreading it. So that was, got it over with. And then they sent us home with a bunch of samples, and I think they were this exact same kit. It might have been a different kit, but it was something that looked like this. They sent us with a bunch of these samples so we could have some until the DME delivered some. And now I'm going to tell you what I have learned since then from Raelynn about cathing people. So first thing, not all catheters are the same, and these are intermittent catheters. If there's nurses watching this, if I'm saying things wrong, you can correct me because I'm not a nurse yet, and I might not have all this right. Like I think I do, but I don't know. These are intermittent catheters though, and they don't stay in you. Like if you've ever woken up from surgery with a catheter in you, that's different. I think that's called a Foley catheter. It has a little bubble so it doesn't come out. So these, it's like a straight cath, and it doesn't stay in. So you put it in, get the urine out, and then you take it out. It doesn't have to stay in. So they sent me these. Then DMEs are durable medical equipment companies, and we called our DME, and the doctor sends a script to the DME, and they send you your supplies. So these are what we learned on, and I'll open it up and show it to you. But what they sent me, I like to say, was a box of straws. I mean, it wasn't, but it was just these tubes that were obviously the right size with the right, you know, endings in sterile containers that you would like open up. I mean, just like long tubes in containers like this that would just pull open. And I think like a big old tube of like, I think it was water-based lubricant so that you could lubricate it so it would go in easier. After using these, I was like, what is this? Like, no. And I have a Facebook group with other medical moms in our state that have kids that get home nursing, and I was like, look what they sent me, and this is what I'm used to. And people are like, here's what you need to do. Here's how you get these. Has she ever had UTIs? Tell them you need more sterile equipment. And they told me, don't use your regular DME, use 180 Medical. So plug for 180 Medical. If you know someone that needs catheters, if your area has access to 180 Medical, they are great for supplying catheters and helping you make sure you get a type that works for you. And telling the doctor even like what they need to put on the script to get approved, the one that works for you, I think. So 180 Medical started sending us these. And here is why this is better than just the straws. So in the hospital, and if you're inpatient, the hospital just has what I call the straws. You have to get a urinal container and put obviously one into the straw in the urinal container and one into the straw into the person whose bladder needs emptied, and you're juggling a lot. And for a person who has contractures or is nervous or jumping, like that's a lot for one person to juggle. But this collects the urine so you don't have to worry about juggling a little, I don't know what they call them, but it's a container that holds pee that the straw goes in. This has a bag, and on the bag there are little numbers, and it tells you I don't know if you can see that, but it tells you approximately how many mils you have cathed out to, if you need to tell, you know, if you need to measure how much someone is outputting. And it's nice and clear so you can see the color of the urine, if it's cloudy, if there's mucus in it, which is all stuff we've come to appreciate. We're like, oh, you have nice pretty urine. You can't tell that in a diaper. So when we do have to catheter, I always try to take note, is it extra dark? Is it extra cloudy? Or is it nice and clear? And it varies for her from time to time. But if I ever was consistently seeing dark or cloudy or mucus, you know, I would call the urologist and say, hey, we're all the time getting this urine that looks like this. So it's also an opportunity to examine how does her urine output look. So this comes off. And then this is already lubed. See the jelly on it? And it's already lubed, so you don't have to worry about that. And this tip just pushes up. And you can push it up as far as you need. I do it about this far to get it into her bladder. And I hold it like right there so that it doesn't go back in. Like if I didn't hold it and I wasn't aiming good, it would just slide in maybe. You know, so I hold it down at the bottom so it doesn't go back in as we put it in. Also, gravity. So if I can have her higher up on the bed or push the mattress down some while I'm cathing her to let gravity help it flow, just like a hose, or you know, if you're siphoning something. So wheels like gravity, that's something that's really hard to do if you're trying to juggle a container for the straw. Like this can go much flatter than if I had a container I was trying to get lower than her pelvis. When we first started, like it stopped scaring me. One, I don't think cathing bothers Raelynn as much as cathing bothers me. And I don't mean like bothers me to cath her, because that doesn't bother me at all anymore. I mean, when I'm cathed, I find it very uncomfortable and irritating. And I don't think Raelynn finds it very uncomfortable or irritating at all. Like really, I don't think, sometimes she jumps a little, sometimes I think it's a little bit uncomfortable, but everyone's different. I've read about it, and you know, some people just don't find it as irritating as other people. But just because she doesn't find it irritating doesn't mean she's super easy to cath. So we would frequently miss, and you know, when you're little bitty, it can be harder to tell anatomy and what's what, and there's just little folds of skin and stuff. And you just couldn't always see exactly where you're supposed to go. And I don't know what the name is for that. I'm sure I'll have to learn, but like is it a urethra meatus? I don't know. Maybe a nurse will comment below what it is. You can't always tell where that hole is in her. And I don't think she's the only one, but everyone's anatomy is just slightly different. And when she would need cath, even at the ER, people would be like, I can't tell, I can't see. And sometimes you accidentally go up in her vagina instead. And so she's not easy to cath. But after we first started cathing her, I think the first time she was hospitalized for something afterwards, the nurse said, "Oh, I see you cath her. Do you want to do that if she needs cath?" And I was like, no, you guys do it. I'm not good at it. And I was thankful like someone else is going to do that, because I wasn't scared to do it anymore. It didn't scare me that I was going to hurt her. I just wasn't good at it, I thought. That hospital stay, I learned I'm as good as it as anyone else. Now, maybe there's nurses that are better at cathing than me for sure, but for Raelynn, I'm as good as any nurse for cathing Raelynn, just because everyone's unique and I've cathed her more than anyone else. That day they kept trying to get it. I was still so new to cathing, and sometimes I missed, and I just figured she's being extra difficult to cath. They ended up making her bleed, and the urologist actually came and looked, because that was not good, and he was mad. I could tell he was mad, and he told them in front of me, no one caths her but mom. And that's when I realized she's just hard to cath, and I'm gonna be more patient, maybe. I mean, I don't want to say nurses aren't patient, but because they are. I mean, but like, I don't have 5 other clients, and I'm gonna be more familiar with her. I'm maybe more timid than they are, just because I haven't cathed as many people. Ever since that incident, I really think she grew some scar tissue, and that's actually made it even harder to cath her because of that. So yeah, she is difficult to cath, but just because you're missing doesn't mean you're not good at cathing. It's just everyone's anatomy is different. And that's how I learned that just because I'm missing doesn't mean I'm not good at it. It just means some people are harder to cath than others. What I've learned, okay, so I've learned I can do it, and it doesn't make me nervous at all anymore. I'm really, really hoping that's how it goes with IVs, because for nursing school, I think what I'm most scared of doing is trying to find a vein and insert an IV, and like that really, I've started watching YouTube videos of them showing how it's done. I'm trying to like desensitize myself, because even when Raelynn gets IVs, like I can watch, like I watch a little bit, but a lot of times I'm just like, okay, I've seen enough of that, and I just pay attention to Raelynn and talk to her. I don't like watch it. Sometimes they dig, because she's a hard IV stick too. Sometimes they're digging, and because they're doing the best they can. So yeah, how scared I was to do it, and now the fact that I'm not scared, I tell myself that with IVs. I'm scared to do it, but once I do it a couple times, I'm not going to be scared. It's not going to be a big deal. I hope that's right. Honestly, had I not worked through this fear, I don't know if I would have thought I could go to nursing school. Had I not already done something I was really scared of doing, I don't and seeing that you get over it. I don't think I could have gone to nursing school. I don't think I would have had I not had this experience. So that is good. Things I have learned about cathing. First, let's look. There are gloves. I'm not sure if these are sterile gloves or not. I think they are. But they're not packaged like most sterile gloves. Like most sterile gloves have little paper packaging. But if you're trying to keep them sterile, you wouldn't hold them like this. You find this end and you touch the inside of the glove and maybe the wrist of the glove, but not anything else. Now this would be sterile, so I can touch the outside of the glove with this. So, and you do learn how to put on sterile gloves by watching them do that in the ER. And like I said, normally you open them up and they're like, the ends of the gloves are even turned up like this. They're cuffed so that you can grab it and put it on easier. And then it comes with 2 towelettes. So this one is a BZK wipe. I think that's benzalkonium chloride first aid antiseptic. I definitely use this to get her cleaned up beforehand, and it's just like a wet wipe. It doesn't seem like it burns or anything. I've tested it on my skin. Doesn't burn because it's not necessary. Remember, like all they sent me was straws with lubricating jelly. That's all you really need. This is like the deluxe kit. So this isn't necessary, but I usually use this, and it's just like a wet wipe. It doesn't sting. I guess it's antiseptic. It kind of looks like what you get after you eat ribs at a restaurant. And then they also send you this, which is Providone iodine swab sticks. They look like giant Q-tips with the red-brown liquid in them. So at the hospital, if they catheter, they have to use these. It has something to do with like infection control in a hospital. They have to use these, and there's 3 of them, and I don't have to use them at home, and I'll talk about that. But there's 3 of these Q-tips, and you go down one side with one, and you set it aside. You get the second one, you go down the other side, and then you go down the middle with the third. And that is patient preoperative skin preparation, helps to reduce bacteria that can potentially cause skin infection. So hospital protocol is they have to use these if they are cathing her. I don't have to use them if I'm cathing her in the hospital unless they're trying to get a sterile urine sample, and then I think they want us to use these if they're trying to get a sterile urine sample to help get as sterile of a sample as possible. So now, why not use them if they're in here? One doctor told me, and I haven't been told otherwise, so I don't know if all doctors would say this, but one doctor told me that, you know, when you're constantly using all these, you know, antibacterial things, if you don't need them, it can make things resistant, like antibiotics. You know, don't use them if you don't need them. He's like, this is overkill for home. It's hospital procedure, but if someone's being cathed all the time at home, this is overkill. So we don't use these. We do save them up. They kill bacteria. So I've had a nurse that asked, she's like, you don't use these? Do you mind if I take some of them home for, I forget what she needed them for. But I was like, no, sure. My mother-in-law got a cat scratch or cat bite that was getting infected. Looking bad, I'm like, here, why don't you put some of this on it? And it really helped. One time we were traveling, Raelynn gets impetigo. It's like a nasty little sore. She always gets it on the corner of her mouth when she gets it. That's the only place she gets it. But like once or twice a year, Raelynn gets impetigo. We were on vacation in Florida, and that popped up, and I was like, what do I do? And I can call the doctor, and they'll call in a script. Like, she gets it often enough. They don't need to see her. But in Florida, insurance wasn't going to cover stuff at a Florida pharmacy. I knew we had Illinois Medicaid. That was the only thing we had for her. They would cover prescriptions we picked up in Illinois and Missouri, but not in Florida. So I was like, what can I do while I'm on vacation? I actually dabbed a little bit of this 3 times a day on her infant Tyco, and it helped. It worked. I don't think it worked quite as good as, I'm going to say it wrong, but Repurposing, the gel they normally prescribe, but it did work. And so this is just great. It is good for cleaning. It's antiseptic if you need to clean up a cut. So we save a few of them. We get we don't save them all. We throw most of them away because we don't have a need for that many iodine swab sticks. But so that's what's in there. I think this is a Modesty. I think this is a Modesty cloth, like for privacy. I don't get it. I don't know. I never used that. Or if I did, it would be to set this supplies on, but I don't think that's what it's for. It's a under pad. I guess it's waterproof. It's an under pad, I guess, if you were to accidentally pee around your catheter, which does happen. But she has a diaper under her, so yeah, I don't use that. It's not Modesty, it's under pad. So yeah, we don't use that. So gloves and this, and then I don't know how long we had these before I realized it says to empty, tear here, and you can tear this off and it'll tear off the corner so you can dump the pee out. I think I learned that when we had to get a urinary sample, because you can't just send them a bag. You do that and then you pour that into the collection cup. So that is, I think that's everything I can think of that I've learned about cathing. They care about being super, super sterile in the hospital, not at home. It irritates some people more than others. Oh, you get colonized. So if you have to cath often, a lot of times your body just gets colonized with bacteria in your bladder. And it doesn't mean that you feel bad. It doesn't mean you have a bladder infection that needs treated. It's just what happens, I guess. We take her to the ER for something. If they take a urine sample and they get it back, a lot of times they're like, oh, she has a UTI, you need to put her on antibiotics. I had one doctor insist, like, she needs to be on antibiotics. And I would just be like, you need to call her urologist. No, she doesn't. I don't want to start her on antibiotics. So every single time when I've gotten them to get a hold of her urologist, he's always like, does she show any signs of infection? And if she doesn't, they don't start her on antibiotics. The only time I said start her on antibiotics instead was before her last spine surgery. I wanted to know any chance of any bacteria anywhere, and we wanted to kill it. So we got her on some extra antibiotics to kill some bacteria that was in her bladder before her last spine surgery. But generally speaking, if you're cathed all the time, you might show up that there's bacteria in your urine, or I don't know what they look at, leukocytes. I'm saying it wrong, whatever it is. But her urologist knows how to look at those test results and also her symptoms and decide if bacteria needs antibiotics to treat or not. And usually 90% of the time, they don't need to treat them for her. So just know, like, if someone's cathed all the time, just because their urine samples show they have a UTI doesn't mean it's something that needs treated. You can they call it being colonized. And yeah, one ER doctor did not believe me. And he wanted to give her antibiotics in the ER. And I was like, no, we don't need to. Like, I've been at the hospital with her and doctors have said the same thing. And I've asked them to call urology. And then urology also always says, no, don't treat, because you can get too many antibiotics and then your body's resistant to them. That doctor was like, fine, you can go home and I won't start her on the antibiotics, and I'll send this to her urologist and he can start her on them tomorrow because she's going to need to be on them. Well, he called me the next day and they're like, you are absolutely right. Thank you for telling the doctor not to start a course. She doesn't need them. So that was a little bit of, it's really weird to tell a doctor, no, you don't agree. But that was the right thing to do. And it's just because Raelynn is a unique case. And, you know, I don't know how many patients, he was not a urologist, he was just a general, you know, ER doctor. I don't know how many UTIs he sees, how many people, UTIs who are cath regularly. But yeah, it was something he didn't know. And I just had to kind of insist, no, I don't want her to get these antibiotics because in the past doctors have wanted to and their urologist has said don't. And I've had to do that at Children's too. It's just easier at Children's Hospital because I can be like, call urology on call. Also, when she's been inpatient, another thing, so that I've had to tell the doctors, nope, treat Raelynn different. When she was inpatient, they wouldn't want a catheter unless she'd gone 12 hours without peeing. Or also, they want to get the bladder scanner off the floor and like scan her bladder to see how much urine's in it. They have this machine, like an ultrasound machine, that will like guess pretty accurately how much urine's in your bladder. And I would have to say, look, if you're pushing IV fluids in her at like 100 mils an hour, she can't wait 12 hours to go pee. And we don't need the bladder scanner. And I had to a few times, they said that's our protocol. And I would just say, can you please call urology and check with them for Raelynn? And when I would say that, they would, and then they'd come back and they'd say, okay, you do whatever you do at home. But I mean, I had to speak up and say, this is what the urologist told us. So I think that's everything. A lot about cathing, a lot of information. If you have any questions or if you have any corrections for stuff I've said wrong or something, feel free to give a comment below. Now, Chris has a lot to edit.